I'm going to walk you through the process of a planned cesarean. The mother would arrive at the hospital at the scheduled time that she and her provider have decided upon. Depending on the facility, she would either go to the pre-op area or she would go to a delivery room, like a labor and delivery room. An IV is started right away, and she would receive bacitrate antacid right upon her arrival. The nurses would make sure that her bladder is emptied and she would receive a catheter. They would be going over the consent forms for cesarean, and at that time, if the mother hasn't already been asking questions, she's free to ask any questions that she might have about the procedure. The anesthesiologist comes in, and he or she also goes over the consent forms for the actual surgery itself, as well as the placement of the epidural. And again, you could ask any questions that you might have specifically for the anesthesiologist. After that, the mother's pubic hair is just trimmed. In the past, it used to be shaved, but now it's just clipped or trimmed a bit. She's gowned up, and she either walks to or is wheeled to the operating room. Once she's there and gets settled in the operating room, the anesthesiologist will begin the spinal epidural process. And typically in most hospitals, one support person is permitted in the operating room during a cesarean. And if that person is there during the placement of the epidural, they would be sitting in front of the mother, the mother's able to lean over on him or her as a support person while that epidural is being placed. And then during the actual cesarean procedure itself, that support person would be placed at the head of the bed, kind of calming the mother, talking her through it. There's a drape that's placed between the mother and her support person and the actual team doing the surgery. In some hospitals, it's a clear drape. In others, it's the typical blue, very surgical looking drape. So the mother's laid flat on the operating table, and then the incision itself is made to actually deliver the baby. And from the first cut to when the baby's out is usually like around 10 minutes. It's really fast. It just takes so much time to prep the mother. That's why you have to show up hours before baby actually comes. So after the incision is made, the baby is either walked out gently or is delivered in a more traditional manner. And there you have it. Baby's out. We hear that first cry. And if everything's going well with baby, everything is fine with mother. Many hospitals allow immediate skin to skin right there in the operating room. Oftentimes babies born by cesarean might need a little bit more stimulation than a baby who's had the time to travel down the birth canal and be birthed vaginally. So sometimes baby will need to be taken to the warmer or suctioned or just get a little bit more vigorous stimulation, and then will be brought right back to mother to be placed to her chest, and they can have their first meet right after all of that's taken care of. And then the procedure for closing up the mother, if it's a first-time mother, first-time cesarean, the closing up process is around 45 minutes. If it's a second baby or more babies, more cesareans, that's closer to an hour. And that's, of course, give or take based on each mother's actual incision and her provider, but that's just an average. Many women talk about feeling a lot of pressure during this portion of the procedure, and it can cause a lot of nausea and even vomiting, which is very normal. If the baby was breech or really low in the birth canal or really high up, like in the ribs, the mother might need a little bit more stitching up, or might feel a lot more sensitive because there may have been the need for a vacuum extraction, because baby couldn't just be walked out or delivered in a little bit gentler fashion. So sometimes the closing up process after something like that takes a little bit more of a toll on mom. And then the mother is given a prophylactic antibiotic to help reduce the risk of infection. That's a standard procedure in the process of cesarean. And then she's in the post-op area for about 2 hours or so. and then she is moved to her postpartum recovery room. And for a cesarean birth, you can expect to be in the hospital for about 3 or 4 days, assuming there's no complications with you or baby. So really, yeah, that's the process of cesarean birth, the consent forms that you would have to go over before that, and that option for how you can give birth to your baby.